Rebecca Nyadak lost her legs in a landmine explosion. She's a refugee from South Sudan and was sent to Addis Ababa for physical therapy treatment. Now, after 2 years, she's learning to walk again.
When we came to Ethiopia, they welcomed us. We came because of the crisis. Now we're waiting to learn how to use these artificial limbs. This is the second time for me to come here.
Ethiopia's physical therapy program is just getting started, and the demand is staggering. With an estimated 105 million people in the country, there are only 17 doctors of physical therapy. Baruch Gebre was one of the first.
When the program started in 2002 in Gondar University, I was among the first students to enroll into this program. And after 10 years, when Ethiopia launched this doctoral program, I was also the first to enroll to this program. So for sure, I feel like a pioneer for this profession.
3 doctors of physical therapy work at this clinic in Addis Ababa and treat patients like Rebecca. Others are scattered across the country. As of now, they're graduates from the first and only doctorate class in Ethiopia. Mohammed Hussein is another patient. He had a stroke and relies on his rehab to move again.
I suffer from partial paralysis and was shocked when I found out there was physical therapy here. I thought it was a luxury, not this available.
The services here are free, paid for by the government, but when we visited, there were few patients getting help at the clinic. One of the biggest challenges with physical therapy in Ethiopia is lack of awareness. Most people don't even know that facilities like this exist. But even if they did, there still aren't enough therapists to treat everyone.
This misconception exists in most parts of our country because not only physical therapy, even the whole rehabilitation service is considered as a luxury.
Some of the physically disabled are often reduced to begging, at times relying on their disability to make money. Even though Ethiopia's physical therapy program is relatively new, it's still more developed than in neighboring countries. Many patients from South Sudan, Sudan, and Eritrea rely on the facilities here to gain their life back. For Rebecca, her new legs mean she can get around in the refugee camp where she lives. Part of her treatment is learning how to walk on uneven ground, similar to the surfaces in the camp.
During the time when I didn't have these legs, I was just sitting at home with no place to go because I had no mobility.
Progress on a national level is slow going, but for patients here, it comes one step at a time. Leah, Al Jazeera, Addis Ababa.